Dear friends, as we know that in the pandemic of the corona, you can call World War C, World War Corona. So it is our duty to explain our patients and take care of our patient in this problematic period. So there are certain issues are there while managing a patient of diabetes. I know you all know most of the things, but I am just going to reiterate some of the things to just refresh, and you can achieve the better diabetes management in these patients of the diabetes mellitus. The 7 self-care behaviors are: the first is that healthy eating or diet control. Second is the regular exercise, or you can say the being active. Third is the monitoring, and the fourth is the medication. Fifth is the problem solving, and sixth is healthy coping, and the seventh is the reducing the risk. So friends, as I mentioned, the diet is an important component of management of diabetes, whether it is type 1 or the type 2 diabetes. So recommended dietary calorie is always on the basis of the ideal body weight. Let me tell you what is the ideal body weight. Height in centimeter minus 100, that is the ideal body weight. For example, a person of 170 kg, his ideal body weight is 70 kg. So we have to calculate a calorie on the basis of the 70 kg weight, not on the basis of the existing body weight. And these calories can be calculated on the basis of his physical activity. I'm sure right now most of the time physical activity is limited, so it can go up to 20 to 20 kilocalorie per day. And these calories can be divided into the 3 meals and 3 snacks. So you can take the major meals of the 20% of the each time. So the 60% calories can go to the major meals, and remaining 40 calories can go to the 3 snacks form. Then coming to the exercise is also very important component of management of diabetes. I must say that is the most important component of management of diabetes, because it only not give you physical health, but it give you a mental health also. And to achieve the further good mental health, you can do some pranayam and yoga that will help to give strength to the respiratory system, and that respiratory system will also help to overcome the corona crisis, because the most of the patients do die because of the respiratory issues. And the third thing is the monitoring. I'm sure the monitoring is very important, and we should suggest our patients to do the regular monitoring to know that how is their blood glucose, how is the blood pressure is controlled. The blood glucose control, though it is said that you should do 7 times a day, that is for the type 1 diabetes. For the type 2 diabetes, what we can do is that if the blood glucose in the target range, meaning by that if the pre-meal blood glucose is somewhere between 90 to 130 milligram per deciliter, and the after meal if it is somewhere 160 to 180 milligram per deciliter, meaning by that is in the target range. So you can repeat monitor the blood glucose once in a week, that will be sufficient. But if the blood glucose is higher and uncontrolled, in that case the patient can do their blood glucose monitoring more frequently, maybe at least once a day, and it should be at a different period of time to have the overall view that how is their blood glucose control. For example, Monday they can do on the fasting, the Tuesday they can do the post breakfast, Wednesday they can do the pre-lunch, Thursday they can do the post-lunch, Friday pre-dinner, and Saturday post-dinner, something like that. So you can have a complete profile of your blood glucose, and that is easy for us to guide them during this period, that how they can, if anything required adjustment of the medication, they can do that. Then coming second in the monitoring is blood pressure. It is very important, and we all know that the target blood pressure in the patient of type 2 diabetes is 130 by 80 to 85 milligram per mm of mercury. So they can do at least once a week their blood pressure monitoring. Then comes to the medication. I know you all know about the medications, that how much to be prescribed and all, and but it is important that every component of the diabetes should be targeted. So the good glycemic control, good blood pressure control, good lipid control, as well as if they are taking any extra medication for their coronary issues, they should continue, they should not miss the medication. That is an important. Now coming to the most important part is that problem solving. In this period, the patients are actually feeling that they are not connected with the healthcare professional, so they may face some problem. So in the diabetes, the most important problem is that they may develop the hypoglycemia. So we should educate them about the hypoglycemia and management of the hypoglycemia. As you all know that is formula of 15-15. Hypoglycemia, give 15 gram of glucose and repeat blood glucose after the 15 minutes. If it is in the target range, it's fine. If not, then they can repeat their blood glucose again after repeating their glucose dose of the 15 gram. And then we should give them good tip about the do's and don'ts of the food care. That is also very important, because if there is some problem by doing their bathroom surgeries, cutting their nails not carefully, trying to remove the corn by themselves, they should avoid all these things, because that can end up with the diabetic foot problem. And in this time, it is always difficult to go to the hospital, so avoid all these things. So, and then this period of time, you are the leader for the patient. So if you are aware, you can be touched in with your patient by these various communication mediums. Then healthy coping is another important, to keep them mentally strong that this is not a problem, and by guiding carefully, properly, this crisis can be converted into the certainty by having good lifestyle, adequate dietary modifications, and good exercise. And the final is that by achieving all these parameters like good diet, appropriate exercise, appropriate blood glucose and blood pressure monitoring, taking optimum medication, by problem solving as well as healthy coping, we can reduce the risk of various complications those are related to diabetes, like neuropathy, nephropathy, and retinopathy, as well as the hypoglycemia, any acute complications like high blood glucose or the ketosis, etc. It has been scientifically proven that if you stick to all these 7 self-care behavior, then you can reduce your blood HbA1c by 1.1%. Thank you.